So topic for today, that is dysphagia. And dysphagia, it means difficulty in swallowing. Where can it occur? It can occur at any age, but more commonly it is seen among the older adults. And depending upon how the patient presents to us, it is divided into three subtypes. One is oral dysphagia, oropharyngeal dysphagia, and the third being the esophageal dysphagia. Where in case of oral dysphagia, the complaint would be specifically like the patient might be having difficulty in chewing or breaking down the food. If we talk of about oropharyngeal dysphagia, there is difficulty in initiating swallowing, and esophageal dysphagia, where there is difficulty in passing the food down the esophagus. Right. Now let's see about the causes related to esophageal dysphagia. So if there is esophageal dysphagia, the sensation would be specifically as if the food is sticking to the base of the throat. Why does it occurs? It occurs due to the very first cause being echalexia. So echalexia is that when the lower esophageal sphincter it doesn't relax properly, what happens that it will regurgitate the food back to the throat, and the muscles which are in the walls of esophagus may be weak as well, and this condition usually tends to worsen over time. So that is the consideration in case of echalexia, right? Second cause is diffuse spasm. If we talk of about diffuse spasm, then it is a condition which will produce multiple high pressure and poorly coordinated contractions. Multiple high pressure and poorly coordinated contractions of esophagus. Now this diffuse spasm, so you can see it in the picture, would specifically involve the involuntary muscles of walls of lower esophagus. Tumors or scar tissue often it causes narrowing, and that is usually because of GERD, but that is in case of esophageal stricture. So esophageal stricture, it is a kind of narrowing of esophagus, and that is usually tumors and scar tissues which is caused by gastroesophageal reflux disease, and that causes narrowing. The causes for the esophageal strictures, the first being esophageal tumor. Now, dysphagia in case of esophageal tumor, usually it tends to get progressively worsen over time if the esophageal tumors are present. If we talk of about foreign bodies, so this is usually in case of older adults, those who are using say dentures, and those who already have the chewing difficulty. They are more likely to face this problem where the food that would be lodged in the throat or in the esophagus. So that is for foreign bodies. Here the picture, 1 minute, just a second. Here the picture it specifically shows the narrowing of the esophagus, right? Now the third factor being esophageal ring. Now this is specifically a thin area of narrowing which is seen in the case of lower esophagus, and this can intermittently cause difficulty in swallowing solids. Okay. Next being GERD, that is gastroesophageal reflux disease. If there is any damage to the esophageal tissues from the stomach acid which is backing up into the esophagus, and this leads to spasms, scars, and the narrowing of lower esophagus. Okay, so ultimately if there is damage to the esophageal tissue because of the acid reflux, it causes spasms, scars, and narrowing of the esophagus, ultimately causing esophageal strictures. Next is eosinophilic sorry, that pardon. Okay, so next is eosinophilic esophagitis. If we talk of about eosinophilic esophagitis, usually this is a condition related with food allergy, and this is usually caused when there is overpopulation of eosinophils in the esophagus. Scleroderma, that is development of the scar-like tissues that will cause stiffening and hardening of the tissues. Now this usually weakens the lower esophageal sphincter and it will allow the acid to back up in the esophagus, and this will cause frequent complaint of heartburn. Radiation therapy, again cancer being a cause, if the cancer treatment is being undergone, it leads to inflammations and scarring of esophagus. Okay, so this was about esophageal dysphagia. Now let's see what about the oropharyngeal case of dysphagia. Now there are certain conditions which usually weakens the throat muscles, making it difficult to move the food forward, and because of this the person either may choke or gag when trying to swallow, and they have a sensation like food or fluid is going down the trachea or up to the nose, and also this condition can lead to pneumonia, or you can say aspiration pneumonia. This develops due to certain disorders like the neurological disorders, as such multiple sclerosis, muscular dystrophy, or Parkinson's disease. Neurological damage say from stroke, or either there is brain or spinal cord injury. Next is pharyngoesophageal diverticulum, that is Zenker's diverticulum. Now here a small pouch this is specifically formed and that collects the food particles in the throat just above the esophagus, and this will lead in difficulty in swallowing, produce gurgling sounds, will have a bad breath, and repeated throat clearing or coughing. This is called as the complaints associated with Zenker's diverticulum or the formation of pharyngoesophageal diverticulum. Cancer, certain cancer or cancer treatment also can cause dysphagia. Okay, so these were the causes. Now let's see about the risk factors. A very easy and short and sweet topic to understand. Usually it is seen in cases of aging or due to certain health condition as discussed above. Complications, the patient is not able to eat properly, so will be having malnutrition, weight loss, dehydration. Also, if the patient may choke or gag is seen, so it can lead to aspiration pneumonia, and there is a complaint of choking also. Symptoms in case of dysphagia would be either there is coughing or choking while swallowing, there is difficulty in initiating swallowing, changes in the voice or speech, sinking of food and throat, and foreign body ingestion. Correct? If we see about the investigations in case of dysphagia, first is barium X-ray, second is endoscopy. Now this is a test specifically called as the esophageal muscle test or manometry. What is done here, that a small tube is inserted into the esophagus and it is connected to the pressure recorder to measure the muscle contractions of esophagus, specifically during swallowing. Here one can see very easily in the picture that here the lubricant inserted catheter tube that has been inserted through the nose and is guided down the stomach in the first picture. Second is catheter is placed while the person is lying on the side, and doctor measures the lower esophageal sphincter muscle contraction. This is how the esophageal manometry comes out, which is at 6 different levels: at the level of pharynx, at the level of upper esophageal sphincter, this 3 4 at the level of esophagus, and this at the level of lower esophageal sphincter. Okay. And the last is the consideration or the taking of imaging scans. Treatment in cases of oropharyngeal dysphagia. Usually, the patient is referred to the speech or swallowing therapist, and that includes usually learning exercises. The main principle behind it is to re-stimulate the nerves and to coordinate the swallowing muscles. The main principle is to coordinate the swallowing muscles and to re-stimulate the nerves. And in case of esophageal dysphagia, if you see the procedures like esophageal dilatation, surgery, and medicines like corticosteroids and muscle relaxants are to be given. Okay, so that's all in case of dysphagia. I hope you enjoyed. Thank you so much. Follow for more.